Hi, welcome to our medication class, a pivot snippet. Today we're going to talk about metformin micronutrient deficiencies. My name is Dr. Amy Naprick, and I welcome you to this class. Here is a necessary legal disclaimer. Dietary supplements are not evaluated by the FDA and are not intended to diagnose, treat, cure, or prevent any disease. Always consult with your own healthcare provider before changing any of your medications or starting a dietary supplement. This presentation and other information at my website, www.dramynaprick.com, are for information and educational purposes and should be independently verified and assessed before making any personal healthcare decisions. Let's talk a little bit about a medication that can be used for prediabetes and type 2 diabetes called metformin. Metformin is in a medication class all by itself called biguanides. Metformin works by decreasing sugars made by the liver, decreasing sugar absorption in the intestines, and increasing insulin sensitivity of the cells. Insulin is the key to allow sugar to enter the cells. In prediabetes, metabolic disorder, and type 2 diabetes, the cells are so saturated with sugar that they start to ignore the signal from the insulin. So insulin is knocking, but the cells are just ignoring it. Metformin comes along and knocks just a little bit harder, so the cells will take up more sugar. There's also caution advised when using metformin for people with congestive heart failure or decrease in kidney function due to kidney disease. Side effects of metformin can include diarrhea, and that's related to the sugar that doesn't get absorbed in the gut. It can also cause nausea, vomiting, metallic taste, headache, rash, physical weakness or lack of energy. There's also a rare side effect called lactic acidosis, and this is usually related to the kidney dysfunction that I just mentioned. So let's talk a little bit about some micronutrients that metformin can deplete. Those are vitamin B12, also known as cobalamin, folic acid, also known as folate, and coenzyme Q10. Vitamin B12 is important for red blood cell production, the formation of DNA in our cells, nerve function, metabolism, and energy production. A vitamin B12 deficiency may lead to memory problems, nerve damage, an increased risk of Alzheimer's disease or dementia, and mood changes. People with long-term severe B12 deficiency can develop a type of anemia, which manifests as weakness and fatigue. It is also linked with an increased risk of cancer as well as heart disease. Folic acid is key to healthy cell growth and function, the making of DNA and RNA, and it is necessary for the formation of red blood cells. Folic acid is also part of the methylation pathway, which assists the body with detoxification. Folic acid reduces the risk for birth defects and preterm birth. A folic acid deficiency can also show up as an anemia with weakness and fatigue. This anemia often goes hand in hand with vitamin B12 deficiency. In fact, folic acid supplementation can often disguise a vitamin B12 anemia. Folic acid deficiency also shows up as difficulty concentrating, irritability, and headaches. A person with folic acid deficiency may also have mouth or tongue sores and changes in skin, hair, or fingernail pigmentation. As mentioned previously, folic acid is part of the methylation pathway. That's part of the body's detoxification process. Changes to something called the MTHFR gene can inhibit the conversion of folic acid to its active form. This elevates something called homocysteine and can increase systemic inflammation. Therefore, folic acid deficiency can increase the risk of Alzheimer's disease and dementia, cardiovascular disease, and stroke, as well as depression. There is also a higher risk for neural tube birth defects in women of childbearing age if they do not have enough folic acid. Coenzyme Q10 acts as an antioxidant and is critical for muscle health. CoQ10 is needed to create energy in all of our body's cells. It can lower blood pressure, reduces platelet stickiness, which discourages clots and strokes, and provides immune and cognitive support. CoQ10 deficiency can lead to physical and mental fatigue, difficulty concentrating, memory lapses, mild to moderate depression, and irritability. Chronic pain is also common with CoQ10 deficiency, with frequent headaches or migraines, muscle and joint pain, and an increased risk for developing fibromyalgia. Deficiency leads to a weakened immune system, which makes people more susceptible to cold and flu viruses, as well as chronic dental infections. The increased inflammation that can come from a CoQ10 deficiency can lead to high blood pressure, high cholesterol, and heart failure. There's one thing I want to point out, and that is the overlap of nutrient deficiencies with metformin and the signs and symptoms of diabetes progression. Diabetes can be a progressive disease. Nerve damage, development of heart disease, increased systemic inflammation, leading to high blood pressure, peripheral artery disease, and high cholesterol, as well as an increased risk for heart attacks and strokes. All of these things can happen if diabetes progresses. But what I want to point out is that they can also happen with a vitamin B12, folic acid, or CoQ10 deficiency. Sometimes a provider can confuse the nutrient deficiencies caused by metformin as just the progression of disease. So it is important to know about these types of deficiencies if you take or are prescribed metformin. Here is a list of references for this presentation. So, are you ready to pivot to functional health and wellness? Is this your year to discover underlying causes of disease and feel your best? You can contact me today for a free 10-minute connection call. Just email me at info@dramynaprick.com. Feel free to contact me again at that email address, info@dramynaprick.com, if you have any questions about this presentation or to schedule your free connection call. Also, check out my website, www.dramynaprick.com. I have a longer presentation on this topic, as well as other topics, and articles about health and wellness. Thank you for listening. Have a great day.